When I was training in general surgery, the liver and pancreas, by most general surgeons, are kind of thought to be areas that you need to stay away from, because if you get in trouble in those areas, you might find yourself in trouble that you can't get out of. And so I think I'm naturally drawn to the harder things in life, maybe. And when I learned that, it made me want to learn more about that, and it made me not want to fear that area, and it made me want to feel comfortable where maybe other surgeons don't feel very comfortable. I think educating patients is as much of my job as surgery is. Many patients come to me and they don't know very much about their diagnosis. Oftentimes I'm the first person telling them that they have cancer. And in my mind, that means I will take as long as it needs to take in order to answer their questions, in order to sometimes even repeat the same thing, because sometimes you need to hear it more than once. And my hope is that by the end of meeting with me, they not only understand more about what's going on, but we also have a plan and we know what we're going to do to deal with this problem. I think that it's important for all patients to make sure that they take care of themselves. And that's a generic comment, I know, and that can mean different things for different patients. Sometimes it means eating right, sometimes it means sleeping enough hours at night. But even above and beyond that, I would say that enjoy your life. When you have a diagnosis of a cancer or just a bad medical problem, sometimes people focus on that so much that it becomes their entire life. And I guess my advice to patients would be that you are much more than that diagnosis, and that you need to do the things that you love to do, and together we can work to treat that problem and get you back to feeling how you want to feel. I think one of the main things that fuels my passion for the field is the patients. Every patient is so different and every problem is so different, and so it's a challenge for me. But just the satisfaction of being able to get a patient through a diagnosis of cancer, get them through a major surgery, and see them through on the other side and get them the treatment they need is incredibly satisfying.